Good evening. Thank you for joining us. This is our second installment in our Cancer Answer series. We had intended to have 3 of these sessions this year, but unfortunately this is only our second. Our first session was held as an in-person event in April, and we got that in just under the wire before COVID blew up and disrupted our lives in some shocking ways. Those of us that are on the call tonight, I just want everyone to know that it's my sincere hope and my intention to return these sessions to an in-person experience as soon as possible. I think that will offer a better overall event. So I'm hopeful that we can do that maybe for our next session, which is currently scheduled for April of 2021. So tonight it's my privilege to introduce to you Dr. Divine Chi, who not only has the coolest name of anyone who works in the Cancer Center, but he's also an all-around terrific guy. Drug therapy for the treatment of cancer has really expanded dramatically in the last 10 or 15 years. It's become almost a full-time job to keep up with all the different drugs that are out there now, immunotherapy, molecularly targeted therapies. And so it's really become essential to have an oncology pharmacist as part of the cancer team. So that's Dr. Chi's role. He earned his Doctor of Pharmacy through the University of Kansas and was a member of the pharmacy staff there for a number of years before we were lucky enough to acquire him in 2017. He's since that time, he's been at the helm of our Cancer Center pharmacy, and it's expanded substantially under his direction over the last few years. He is a board certified oncology pharmacist and is a trusted resource for all of the clinicians in the Cancer Center. As he and I discussed topics of interest for tonight's session, we thought it would be important to discuss supplements and alternative medicines in the cancer arena. So I will, at this time, I'll turn it over to my friend, Dr. Chi.
All right. Thank you, Dr. Coram, for that wonderful introduction. And again, thank you everyone for joining us tonight. So as Dr. Coram kind of said, we would have much rather had this in person, but unfortunately, because of COVID-19, we kind of have to do this, virtually. So once again, just want to thank everyone for joining. So tonight we are going to be talking about supplements and alternative medicines as they relate to cancer prevention and cancer treatment. So here are my objectives for today's presentation. We're going to discuss the common uses of supplements and alternative medicines, and then we're also going to review the quality of the evidence behind these. We will also discuss the risks and the benefits of doing this, and then I will close out the presentation by just giving some advice on when it's safe to use supplements and when it's not, and how to pick the best supplement and things like that. So before we proceed,
I apologize. Before we move forward, I should have said that we are going to allow some time at the end for questions, but we'd like to hold those until the end of the lecture if we could. You can either type those questions in to the chat box as we go, and they'll stack up, and then we'll get to them toward the end, or there's a raise my hand or raise your hand feature if you know how to use that. But either way, we'll get to questions toward the end. Thank you.
Okay, thank you. So before we proceed, I just want to mention I have no conflicts to disclose for tonight's presentation. And I'm going to leave this slide up for just a little bit. This is a pre-test that I have. Just take some time to see if you can answer some of these questions. We will review them again at the end of the presentation. All right. So supplements are, obviously very popular within the general population. I think the supplement industry runs about $32 billion. And in the cancer population, the same is true. Studies have shown that somewhere between 60 and 80% of patients, cancer patients use some form of supplements or complementary medicines. And so there's a lot of reasons given in surveys, but I kind of have the most common ones here. But people kind of use these to help, boost their immune system, sometimes to reduce side effects from chemotherapy. And some people just kind of want to feel empowered. They want to feel like they're doing something about their disease. And others just kind of want to prevent cancer, or maybe they're, post-treatment and they want to reduce the risk of recurrence and things like that. So definitely good reasons out there. This slide has some of the examples of things we're going to be talking about tonight. I did want to clarify a couple of terminologies that we're going to be using. So when we talk about preventative or complementary use, we're really talking about, using these supplements with standard treatment, so standard medical treatment. And then when we talk about alternative medicine, really, we're kind of talking about anything that is intended to replace standard treatment. So we'll start by jumping into the preventative and complementary use case. And I kind of wanted to just start out with probably the most popular product out there. CBD oil, I think, is at the top of the list when it comes to these supplements. And when we talk about CBD, we're really talking about cannabinoids. And so these are substances that are found in the cannabis sativa plant. And I think the most common ones out there that people know are tetrahydrocannabinol, or THC for short, and cannabidiol, which is what CBD actually stands for. There are other cannabinoids out there, and again, they're all kind of from the cannabis sativa plant, but THC and CBD are the major constituents. So there are actually lots of different sources for cannabinoids. I have the classic cannabinoids, which include hemp and marijuana-based products. So typically, CBD products usually come from hemp or marijuana. So when we talk about hemp and marijuana, we're talking about different versions of the same cannabis sativa plant, so different strains. There are also some prescription medications that are cannabinoids. So there's Epidiolex, which is a prescription version of CBD. And there is nabiximols, which we'll talk about in a little bit here, but it is an equal mixture of CBD and THC. And then there are the synthetic cannabinoids, which really don't resemble the classic cannabinoids, but they do mimic some of those effects. So we have nabilone and dronabinol, which are also prescriptions. And then there are designer drugs like K2 and Spice, which used to be very popular in the early to mid 2000s, but after lots of fatalities, I don't really hear about those anymore, but they are out there. So we know that cannabinoids, work. So even though we're talking about supplements today, I kind of have a lot of prescription medications that are cannabinoids listed here. And the point I'm trying to drive is that we know that cannabinoids have an effect. So nabilone and dronabinol are used for nausea, vomiting, also used for appetite stimulation. And then nabiximols, which is really not used in the US, is actually used for muscle pain and spasticity. It is actually being studied in the US right now for cancer-associated pain, but not on the market yet. And then the prescription that's actually going to be on the market fairly soon is Epidiolex, which I talked about earlier. And this one is actually used for certain types of seizures, is the FDA indication for that. So again, the point I'm trying to make here is that we know that cannabinoids have an effect. They've been studied and there are prescriptions out there for them. The reason we don't use these very often in the cancer population is because they are psychoactive and they are habit forming. They're treated as controlled substances similar to like fentanyl and those opioids. So they're usually not like your first line for nausea, vomiting. So I say that because, when we talk about CBD supplements, CBD oils, foods, etc., the big question is, can we use these? That's what I get a lot of questions from here in clinic is, is this safe to use? Does it work? And the answer is, a bit disappointing, unfortunately. So there are some low quality studies out there that suggest that CBD supplements might have some efficacy against pain and anxiety. And really the best evidence that we have for CBD in general is really for seizures, just because that's kind of what has been most rigorously studied. So at this point, we can't really recommend CBD supplements just because the quality of the evidence behind, using it for pain, anxiety, or anything else really is not very strong. Future research on CBD supplements and products is probably going to be based on the prescription versions of CBD, like Epidiolex, and not the supplements. And this is because it is much easier to design rigorously controlled clinical trials with standardized products. As we'll talk about later on tonight, the problem with a lot of these supplements is that they're not standardized and they're not regulated for safety. And so it's just kind of a risk using them in patients. Briefly talking about medical marijuana, unfortunately, that is not legal in the state of Kansas, but some studies, which are low quality, also suggest some activity against pain, anxiety, depression, and nausea and vomiting. And you may have picked up that you kind of want a mix of different cannabinoids to really have, more effects, so to speak. So really with CBD being mostly cannabidiol, we don't have some of these other effects as seen with, nabilone, dronabinol, et cetera. So cannabinoids in general can have a lot of unpredictable effects with medications, especially oral chemotherapy drugs known as tyrosine kinase inhibitors. But again, overall, just more studies, more rigorous studies are needed on using cannabinoids in cancer patients overall. And the regulatory limitations just make that really challenging right now on the state and the federal level. So speaking of regulatory status, so the regulatory status of CBD in Kansas is a little bit, it's a little bit confusing. So in 2018, the Congress passed a farm bill, and this farm bill really is what kind of kickstarted this whole CBD craze. So before that, the cannabis sativa plant was a controlled substance. And then this farm bill basically said, if you have a cannabis sativa plant that has less than 0.3% THC by weight, it is considered hemp and it is no longer a controlled substance. So that's kind of what started all of this. There is a law in Kansas called SB 282, and that is the law that legalized CBD in the state of Kansas, but that law is much stricter than the Farm Bill. And so this requires CBD products sold in the state of Kansas to be 0%. So that's very difficult to achieve, but that is what the law is. There are other laws out there regarding CBD, but they don't really have anything to do with patient care. They're more about research and using hemp in the industry. There is a very obscure law out there called Claire and Lola's law, and it is basically for people that are profoundly ill and are getting some benefits from CBD products that contain up to 5% THC. So this would normally be illegal, but this law allows people to use those if they have failed other treatments and are profoundly ill. And this is kind of the tricky part. So it doesn't mean that these THC products are illegal. It just means it gives them some protection from the law, so to speak. And finally, the big question right now is, since CBD is now an active ingredient in a pharmaceutical, it is unclear if the FDA is still going to allow CBD to be used as a supplement. Because it's really part of a medication now, and supplements are considered a food, as we'll talk about later. So something very similar happened to red yeast rice in the past. So red yeast rice used to have lovastatin in it. Some versions had lovastatin in it, and lovastatin is a cholesterol medication. So the FDA clamped down on these products that had lovastatin in it because they could not be considered supplements anymore, and they had to go the same rigorous safety testing that medications do. So it is possible that CBD products might go the same way. So all of that being said, some people still want to use CBD products. Perhaps they feel like the anxiety benefits might be something they want to try. So I have this slide here just kind of talking about the sale requirements in Kansas. So if you're gonna, buy a product in the state of Kansas, make sure it meets all of these. So the product must be labeled. It must show that there is no THC in it, and it must have the manufacturer's name and address on there. And something that is kind of nice about this is that they also require that whoever is selling CBD products, they have to provide printed material for the buyer. This material has to be approved by the Kansas Board of Pharmacy, and it needs to provide adequate warnings for improper use. So there's a little bit of protection there, but generally speaking, I would say stay away from CBD products that you are getting over the internet, and try to get these in stores that have been that have undergone certification and have a license. All right, so moving away from CBD and talking a little bit about some of the other supplements that we see here in clinic. So St. John's Wort is another one that people use. It's not used as often anymore, but some people still use this mostly for anxiety and depression. Some studies have actually shown that it is comparable to antidepressants. The quality of the studies weren't very good because they weren't controlled, but they had about the same side effects or even lower side effects than antidepressants. So there is some data out there that St. John's Wort can help with depression and anxiety, especially in cancer patients. The problem with St. John's Wort is that it has too many serious drug interactions. It is probably the biggest, probably the first product out there that pharmacy students learn about when it comes to drug interactions, because there are just so many. There are also some alleged anti-cancer properties out there. And really, this is based on hypericin, which is the active component of St. John's Wort. Some studies have shown that if hypericin is activated by light, it becomes a substance that can kill some cancer cells, but that's about it. So the plant itself doesn't necessarily have anti-cancer properties. So there is no evidence at this point to support that claim. Green tea is the next one we want to talk about. So green tea is used, probably one of the most widely used herbal products. The active ingredient in that is epigallocatechin gallate, or EGCG for short. And there are a ton of use cases for green tea out there. And there is actually some evidence to support them. Most popular is heart health. So, improving blood pressure control, cholesterol, and glycemic control. And there is some, observational type evidence. So not very strong evidence, but certainly something to support this use case. There's also studies out there that show that topical application of green tea can help with radiation dermatitis. And so those are some, some good use cases of green tea. In terms of cancer prevention, though, there is very conflicting data out there. Some studies suggest that it might actually increase the risk of breast cancer after menopause, but some say that it might improve ovarian cancer survival, and it might also decrease the risk of certain blood and skin cancers. So conflicting evidence over there overall, and we really need large trials to confirm some of these. And the other thing about green tea is that it has a lot of drug interactions as well. I think I listed some that are, sure to stand out here a little bit. So tamoxifen is, one that can interact with green tea. Green tea will actually increase the toxic effects of tamoxifen. It can also increase the toxic effects of like blood thinners because it acts like a blood thinner. And then a lot of patients, with multiple myeloma are on what we call proteasome inhibitors like bortezomib, which is Velcade, and green tea actually blocks the effects of that. So it has some benefits for overall prevention of heart health and improvement of heart health, but there are risks as well. And then I wanted to also talk about phytoestrogens a little bit, because there's been, a lot of confusing messaging out there about the phytoestrogens. So when we talk about these, we're talking about plant compounds that are similar to estradiol. They are naturally occurring in foods as, like foods like soy, peas, legumes, flax seeds, etc. These have pro and anti-estrogen properties. So there is, a use case out there for these, usually for menopausal symptoms and hot flashes. so the literature actually supports some of this. It seems like the isoflavonoids, which mainly include soy and peas, seem to be the most effective for controlling menopausal symptoms. Some people also use this to help prevent cancer, and low quality evidence actually suggests that it may actually reduce the risk of breast cancer. But the caveat is that you have to start it young. So starting to use soy and phytoestrogens later in life doesn't really seem to reduce the risk of breast cancer in women. It only does that when started young. A lot of these studies were done in the Asian population, so there is some question as to whether it is applied to Western patients, but the data is out there. It might also decrease prostate cancer risk in men, but the bottom line is, a lot of these studies were actually done using a balanced diet with phytoestrogens and not, over-the-counter supplements. So that's really kind of what we know right now. Supplements tend to have a lot more of these phytoestrogens than foods. So, if you're trying to get preventative benefits from them, it's best to get them from a balanced diet. So that being said, what about, patients that have breast cancer or are survivors? What does the data say? Is it safe for them to use it? Well, yes and no. So some studies have actually suggested that soy consumption is associated with a reduced recurrence in postmenopausal patients if they have hormone-sensitive breast cancer. But other studies have shown that high intake, so I want to emphasize that, high intake is associated with higher mortality in premenopausal women and women with aggressive breast cancers. So really the bottom line with the phytoestrogens is to avoid supplementation, especially if you have an aggressive type like triple negative or inflammatory or HER2 breast cancer, just because the risk is a lot higher in that population. The studies suggest that low to moderate food intake, about 1 to 2 servings of soy products, are safe, but adding supplementation on top of that really is where your risk increases. All right, I wanted to talk a little bit about black cohosh, just because this is another one that I see sometimes in clinic. It's used for menopausal hot flashes, including menopausal symptoms from ovarian suppression. There are really no clear preventative benefits for black cohosh as far as like cancer prevention. Again, it's mostly used just for hot flashes type symptoms. The thing about black cohosh, and the reason I wanted to bring it up, is it tends to interact with a lot of breast cancer medications, like tamoxifen might reduce the effects of tamoxifen. It might actually increase toxicity from regimens that are commonly used in breast cancer, like doxorubicin and docetaxel. And then it is also toxic to your liver. And docetaxel and doxorubicin tend to be toxic to your liver. So then you're doing both of those at the same time, and you're really increasing your risk. So. Ginger, another one I wanted to talk about a little bit, often used to spice foods, obviously, but also sold as teas and etc. So there are many alleged benefits of ginger, and there's just not enough good evidence to support most of them. Some studies suggest, it could help with, things like indigestion, maybe a little bit of weight loss and glycemic control. But really, when it comes to like the cancer population, what is out there that seems to have the best evidence is helping with nausea, vomiting, and really not even when used alone. So it seems like the best benefit for ginger for nausea, vomiting is when you add it on top of standard medications that are used to treat nausea, vomiting. So that's where the best benefit is. It also seems to have some inflammatory properties, but again, no good data for cancer prevention. Ginger doesn't have a ton of drug interactions. It does act as a blood thinner. So if you're consuming supplements on top of eating, foods with ginger in it, you're increasing your risk for that. And it can also reduce the blood sugar of patients on certain diabetes medications. Turmeric, kind of a cousin to ginger, so to speak, sold as a supplement, but also available as foods. The thing with turmeric is that it is very unstable and it's poorly absorbed. So that has kind of made studying this medication pretty difficult. It does seem to have anti-inflammatory and antidepressant properties. and even cholesterol lowering effects. As far as cancer prevention and cancer treatment goes, there is not a whole lot of evidence right now for cancer preventative effects. There were some studies out there supporting this, but a lot of them have actually been retracted fairly recently because the researcher was, investigated. This happened at MD Anderson Cancer Center, but they investigated this researcher and found that a lot of the data was faked. So I think something like 10 years worth of this researcher's data and studies have been, retracted because of alleged fraud. So kind of a bit of a setback there. So in terms of drug interactions, again, it acts like as a blood thinner, but turmeric can also block the effects of many cancer chemotherapies. Saw palmetto is another one that we often hear about in clinic, commonly used to treat BPH and symptoms of prostate cancer. In terms of having any effect on cancer prevention or prostate specific antigen levels in prostate cancer patients, there does not seem to be strong evidence for that. Where most of the evidence seems to lie is that it might help reduce inflammation and possibly lower the urinary tract symptoms in patients that have BPH for the most part. It doesn't seem to have a whole lot of drug interactions though, which is something going for it. And then another thing I wanted to talk about is probiotics. So a lot of patients take probiotics just for, gastrointestinal health, to help with diarrhea, maybe things like colitis. And, these are usually, bacteria from the Streptococcus, the Lactobacillus, or the Bifidobacterium family. Can also include some yeasts like Saccharomyces boulardii. They come from cultured milk products and again are sold as supplements, but a lot of patients that I've talked to in clinic that are using these sometimes use them for reducing the severity of diarrhea from chemotherapy. And there is actually some small data out there, some weak quality data to support this, but it needs to be confirmed in bigger studies. So I think this was mostly studied in like the colorectal cancer setting. So that's kind of where we seem to have some evidence for support of this. The downside to using this for diarrhea is that there is a risk of superinfection. So patients that are critically ill or have a very weak immune system, there've been case reports of bloodstream infections. And so usually what I recommend is if you're having diarrhea and you're thinking about doing something about it, there's cheaper over-the-counter medications that are actually very effective for diarrhea of chemotherapy. And the risk of using probiotics is just at the very least something that needs to be considered when you're having that discussion with your physician. I will say though, it has been safely used in solid tumors. And so I would definitely not recommend use of this in liquid tumors like leukemias or lymphomas, et cetera, just because those patients tend to be higher risk for infections anyway. And so we wouldn't want to add something like this to their regimen. And then briefly want to touch on melatonin. Most people use melatonin to help them sleep, and studies do support this. The benefit's very small, but it's there. It helps people fall asleep, doesn't really help people stay asleep if that's what the issue is. There are some side effects, but they're pretty mild. I just wanted to bring this up because there've been some alleged anti-cancer properties. And so far, there is no convincing evidence that melatonin has any anti-cancer properties. Some studies suggest that, combining it with standard medical treatment might improve the overall ability to tolerate chemotherapy, but that's about it. Really no anti-cancer properties so far. Melatonin has relatively few drug interactions. Essentially anything that is sedating, alcohol, other sleep aids, et cetera, are going to just add to the effects of melatonin. All right, and I also wanted to talk about antioxidants tonight, antioxidant vitamins. So really we're talking about vitamins A, C, and E. And just overall, there have been no consistent cancer preventative benefits shown for antioxidant vitamins, even though, that's kind of what they're known for. If anything, there has been some risks actually shown with antioxidant vitamins if they're overconsumed. So we're talking about A, C, and E. Vitamin E has been shown to increase the risk of heart failure. It seems to increase the risk of prostate cancer. Vitamin A has been shown to increase the risk of lung and prostate cancer as well as some other deleterious effects. So really the bottom line I'm trying to get here is that the antioxidant vitamins, especially taken in supplements, can actually cause harm. One thing that some people don't realize is that a lot of cancer treatments like radiation and certain types of chemotherapies like alkylating agents, for example, like cyclophosphamide, they tend to rely on what we call reactive oxygen species to kill cancer cells. So you can think of those as oxidants, basically. And so when you use antioxidants while on these treatments, what you're doing is you are canceling the effects of some of those. So you'll see some people out there claim that antioxidants help them better tolerate chemotherapy. Well, the concern is that the reason they're tolerating it is because the antioxidants are actually reducing the effects of the chemotherapy. So it's definitely, recommended to not take these if, you don't have a deficiency or if you're not being managed by a physician. Vitamin D or omega-3s have also been talked about in terms of, cancer prevention. And unfortunately, neither has been shown to reduce the risk of cancer. One study showed that vitamin D actually might reduce the risk of cancer-related death, though, but doesn't reduce the overall risk of cancer itself. And it seems like this benefit really is in people that already have a healthy weight. So it's kind of difficult to say what's driving that really. Is it just being at a healthy weight, or is it the vitamin supplementation itself? A pretty recent study actually suggested that vitamin D supplementation might help people who are on checkpoint inhibitors, which is a kind of immunotherapy. It might actually help protect their colon against inflammation and toxicities. So there is that, but certainly it is not enough evidence to suggest putting someone on a vitamin D supplement just for that reason or just for cancer prevention. Older adults definitely are more likely to be vitamin D deficient. So I do think it is reasonable to discuss vitamin D supplementation with your physician, if there's a concern that there's a vitamin D supplementation, but I wouldn't recommend this outright for risk reduction. Again, same thing for omega-3s. They have been shown to actually reduce the risk of heart disease in people who don't eat enough fish, but otherwise not a whole lot there. It might also increase the ability to tolerate chemotherapy, especially for lung and colorectal cancer. All right, and then talking about some mineral supplements, I see people talk about selenium and calcium a fair amount. Calcium supplementation has been associated with a small reduction in colon cancer risk, but again, high doses over 2 grams have actually been associated with higher risk of prostate cancer. Selenium used to be one that was thought to, have overall cancer protection by boosting the immune system. And studies have actually found an increased risk of aggressive prostate cancer and and death from prostate cancer with selenium over supplementation. So again, no clear preventative benefits here. So really, hopefully, I drove the point home that using vitamins and minerals and et cetera is really something that should be considered with care. A lot of people think that over supplementation is a good thing. It can actually be harmful, and it can increase the risk of some cancers. I think who stands to benefit the most from vitamin and mineral supplementation are people who are malnourished and they don't have a good diet. So it's in that case, it's kind of best to work with a dietitian along with your physician to kind of figure out what vitamins they can take. I would recommend avoiding vitamin supplements with very high % daily values. So I have this picture here, and you can see on here that some of these percentages are like 300% vitamin C. This is like 429%. This is actually not a good thing. This is you don't want this. If you're getting these vitamins from a balanced diet already, and then you're supplementing yourself with these supplements every day, that is actually too much. And there is a risk there with over supplementation. All right, other supportive therapies I wanted to talk about briefly. Acupuncture and aromatherapy. These are things that have been studied somewhat, and there appears to be some benefit with these. Acupuncture has been shown to help with pain control and nausea, vomiting control, and just overall quality of life for cancer patients. The thing about them, though, is that they've been compared to sham acupuncture. They've been shown to have about the same effect. So maybe there's a strong placebo effect there. But overall, things like acupuncture and aromatherapy are generally harmless if they're done by an experienced practitioner. So they can be used as an addition to standard treatment, but really not as standalone therapy. Another thing that kind of sounds like something that was dug from like obscure corners of the internet is bright white light therapy. It might at first glance sound like something you would never hear a doctor talk about, but this is actually recommended by NCCN guidelines. So we're not totally biased against some of these things. There is ongoing research right now talking about bright white light therapy, and they've shown that exposure to very high fluorescent lights, light that is close to natural light, can actually help treat fatigue and mood disorders in cancer patients like depression. It's also used a lot in seasonal affective disorder. But again, this is an active, a field of ongoing research, and the NCCN guidelines do recommend this therapy as addition to standard treatment for cancer-related fatigue. I will say though that some of these white light boxes can have UV rays, so you want to avoid those. And you definitely want to avoid them if you have damaged skin or if you're on certain antibiotics like tetracyclines, because they make your skin more sensitive and things like that. So, and then, psychosocial therapies, these are well established. So things like, counseling, social support, behavioral therapies and writing journals, these have been well established to help patients deal with emotional distress and certainly recommended by NCCN guidelines as well. All right, so I want to briefly talk about alternative medicines now. And really the big takeaway is that there is currently no good scientific evidence that alternative medicines can cure cancer. That's basically the takeaway from this slide. There are some very odd things out there. There is, Gerson therapy and the Gonzalez regimen. These are basically regimens that have patients use pancreatic enzymes and coffee enemas, among other things, to help cure cancer. And the studies that established these were very poorly designed, so we can't recommend these. There's very many safety concerns with coffee enemas, so definitely cannot recommend this. A lot of these require you to not be on chemotherapy, actually, because the chemotherapy or whatever conventional treatment supposedly counters the effect of these therapies. So there's also the alkaline diet is another one I've heard. And the idea behind the alkaline diet is that since cancer cells need an acidic environment to survive, you should eat alkaline foods to change your body pH to be more basic so that it kills cancer cells. And this is essentially pseudoscience. It's kind of something that sounds good on paper, but your body doesn't really work like that. Your body works very hard to maintain a very tight acid-base status. And if eating foods could kill cancer cells by changing your acid-base balance, it'd probably be an medical emergency. You'd probably be in the ICU. So it's just something that kind of sounds right, but really doesn't make a lot of sense once you think about it. And then other things like high-dose vitamin C and natural immunotherapy are out there. Natural immunotherapy is just kind of a rebrand of, these claims that eating certain enzymes can boost your immune system to treat cancer. Again, certainly having a good diet is not a bad thing. It helps, there's definitely benefits to that, but as a standalone therapy for treating cancer, can't recommend that. Natural immunotherapy plays on the fact that we actually have immunotherapy, things like checkpoint inhibitors like Keytruda that have been rigorously tested. So they play off of this by saying, well, if you eat these supplements, then you can also boost your immune system to treat cancer cells. So that's really not something that's supported. And then some places still do high dose vitamin C to help treat cancers, but really they've shown that this really has no anti-cancer effects. At best, it might help patients with side effects from chemotherapy, and that's really about it. And then medicines used in Ayurveda are really not evidence-based, and there've been actually several cases of lead poisoning from some of these medications. So now we're kind of getting towards the end of the presentation. I wanted to talk about risks, misconceptions, and just provide some practical advice on some of these things. So I wanted to start with a story that I found on the American Society of Clinical Oncology. It was about a young woman with metastatic uterine cancer, and she was put on a clinical trial, and she asked about taking a supplement, and she was told not to. She did it anyways, and then down the line, she developed some really unusual side effects that were never seen before, and she had to stop treatment. Eventually, she recovered from these side effects, but she couldn't go on trial anymore just because there was too much time passed from her side effects. So in this situation, it's possible that this supplement, whatever it is, interacted with the immunotherapy and caused her side effect. And we will never really know that because as we'll soon find out, supplements are not really well regulated. So here are some common misconceptions about supplements versus medications. So a lot of people think that supplements are well regulated, and that's really not true. So the Dietary Supplement Health and Education Act basically established that supplements are considered a food. So they are considered safe until it can be proven that they're dangerous. Whereas, medications are considered dangerous until they're proven safe in rigorous and very expensive clinical trials. Supplements do not have to have warnings about side effects, drug interactions, or anything like that, which is not true for medications. In fact, the FDA is not even authorized to review safety data of supplements if the supplements were established before 1994. So basically what this means is I can, start whatever supplement I want that is using ingredients established before 1994 and market it without going through any kind of safety testing. And that's, the FDA can't really do anything about that. Of course, there's no such limitation with medications. And again, manufacturers are not required to monitor for side effects for some of these agents. It's actually on the FDA to do that. Whereas with medications, manufacturers have to, so pharmaceutical companies have to monitor for side effects after they market a drug. So those are just some things to keep in mind. Supplements can also be adulterated or misbranded. This happens very often. Usually they're contaminated with bacteria, lead, or other harmful substances. And I have some examples on here. So we have just a few that I want to point out. There is in July of this year, there was this brand of CBD oil that was recalled by the Florida Department of Agriculture because it was contaminated with lead. Some products were contaminated with different types of bacteria, and et cetera. And when the FDA issues a recall, sometimes the manufacturer doesn't even do anything about it. So there was a study in 2018 that looked at recalls from 2007 to 2016 and found that only 46% of adulterated supplements were actually successfully recalled after the FDA asked them to do it. So imagine, taking this and being on something that is suppressing your immune system. And that's really, you can start to see why a lot of healthcare practitioners are biased towards against supplements. And again, as we previously discussed, supplements have a lot of drug interactions, and they can also be toxic to organs like the liver in the case of black cohosh, and et cetera. So this slide is some more case reports of toxicity with supplements. I just kind of want to highlight this case right here. This was a 51-year-old woman who developed renal failure with very high vitamin A levels after consuming over-the-counter vitamin D supplements. So the question is, was this contaminated with vitamin A? We don't really know. And then this 75-year-old man who consumed 10 grams of selenium and died because they were trying to treat their prostate cancer. So again, a lot of liver toxicity, when turmeric was combined with paclitaxel. And again, I have sources to all of these, so you can go read them if you're interested, but there's definitely risks with these agents. So with all that being said, some people might still want to use supplements. Some people are not sure what to do. I would recommend that the best thing to do if you're actively on treatment is to stop taking supplements. It's not because they don't work or they don't have any benefit. It's usually because the benefit is rarely worth the risk. A lot of these supplements are very expensive, but fighting cancer is also expensive. So you kind of want to use your money wisely. And then fighting cancer is distressing, and people are often, vulnerable in this period. And, people that are out there for, their own ends can use that to exploit you. So it's just one of the many reasons that we generally recommend people to stop taking supplements and herbs while on cancer treatment. Now, some people might, not be on cancer treatments and they want the preventative benefits. To those people, I would recommend really a well-balanced diet is your best bet. A lot of the studies that suggest benefits, most of those benefits are actually in people that are consuming a well-balanced diet. And avoiding excess supplementation really is the key, because you increase your risk of certain cancers actually, depending on the agent. If you do decide that you're going to use a herb or a supplement product, the number one thing is to always disclose all of that to all the healthcare providers that you interact with, whether it's a nurse, a surgeon, a physician, etc. If something sounds too good to be true, it probably is. Try to not mix different supplements. Try one at a time if you're going to. Look up the manufacturer, and if you can't find anything that's a red flag, and then we'll talk about GMP certification in the next slide. But if you start having side effects, if your immune system gets too low, if you go on a clinical trial or you get a transplant of CAR T, you really should stop supplements just because the risks are just too high. So talking about GMP certification, what this is a set of guidelines by the FDA on good manufacturing practices. This is what GMP stands for. And so supplements that have this certification are usually, at least there are some standards that are guaranteeing their safety, so to speak. Now, the trick is that some supplement manufacturers either get their own certification or sometimes they don't. And then they just put this generic label on here that says GMP certified. And the thing with this is that this means nothing. What you really want is you want a third party that is doing their certification. And there are some reputable ones out there. USP, United States Pharmacopeia, is one of them. NSF is another, and Consumer Labs is another. So if you're choosing a supplement, don't pick something that just says GMP certified. Make sure it tells you that it's being done by a third party. Look up that third party if it is not USP, NSF, or Consumer Labs. So that's kind of one of the secrets with this certification. You have to make sure that it's being done by a third party, a trusted third party. All right, so to conclude, really, there really at the moment is no good evidence that supplements or alternative medicines can treat or cure cancer. There is some evidence for modest preventative or complementary benefits, but these are often too risky it's just too big of a risk to take in patients actively on cancer treatment, just because these supplements are not well regulated and we don't have a whole lot of safety data. So the most important thing is always disclose any supplement that you're taking to anyone that's treating you, just so that they can run drug interaction checks or kind of tell you when to stop them if there's a big safety concern. And now we get to the post-test. So hopefully you've had some time to think about this, but kind of want to go through the answers really quick. So supplements are harmless because they are natural. That is not true. Supplements can cause harm because they do affect the body. Anything that affects the body can potentially cause harm. Alternative therapies such as yoga, aromatherapy, and acupuncture have no place in cancer treatment. This is false. There is some benefit to some of these. Yoga, for example, is a form of exercise, which is definitely something we recommend in people that are being treated. And supplements are really not well regulated, right? We talked about that a little bit. Supplements should not be taken in mega doses. This is actually risky. And the last one, many healthcare professionals are biased against supplements. This is true. And part of it is because we don't know a whole lot about it because they're not well studied. So we can't make good recommendations to patients. And so this is very true, but this is something that is changing, as evidenced, number one, by this presentation. We're trying to make sure that we can kind of give patients, some good advice on how to do these if they're going to. And then, societies like ASCO and Memorial Sloan Kettering Cancer Center, they actually have sections on supplements now, and they lay out the data and they lay out the risks and the benefits. And so this is something that's changing. And it's not to say that supplements have no place. It's just you kind of have to weigh the risks and the benefits, and you kind of have to do what's right. So, all right. And with that, that concludes my presentation, and I will take questions now if there are any.
Divine, thank you very much for that presentation. Hopefully everyone can see now why Divine is such a critical piece of what we do here at the Cancer Center. Incredibly bright, incredibly overworked, I'm afraid, but always very helpful. That was a very useful, cogent presentation of a lot of information. So I just want to say something, Divine. I hear from patients frequently about this concept of an alkaline diet. Cancer needs an acid environment, and if we eat an alkaline diet, you address that, and I appreciate that. I think it's really critical to emphasize this point that your body will keep its pH in a very tight range, regardless of what you try to do to change it. It will fairly immediately shift it back for its own protection. Certain proteins and the function of enzymes and things like that depends on a certain pH. And as Divine pointed out, if we attempt to change that, if we were successful, and we usually won't be, it would actually cause harm and disrupt our normal physiology.
I actually have a question watching that myself for you. With the turmeric that you mentioned, you said it doesn't absorb well. So what form do you suggest for the best absorbing form of turmeric?
Well, so I think that's really the thing is we don't know. I know that the researcher that I talked about, who's a lot of his data had to be pulled. This researcher was actually working on a more easily absorbable version of turmeric. And I don't really know what's the status of that right now, but there are people working on making it more absorbable. But right now, I mean, it's not so much that taking some turmeric you're not going to get any absorbed. It's just that it from a clinical trial standpoint, it's difficult to quantify exactly how much a person is getting absorbed in their blood, just because it's not. So really that comment about it not being absorbable is just more about setting up clinical trials and not necessarily just average supplementation. I don't know if that answers your question, but.
It does, yes, thanks. And Divine, we actually had a question from Greg in the chat box. He said he takes 2,000 IUs of vitamin D daily. Is that too much?
That is a good question. And, I can't really answer that without knowing everything else about him. On the surface, it would seem like 2,000 IUs of vitamin D daily is not a whole lot, but that also, depends on like dietary intake and things like that. So, I mean, we can certainly, talk offline and talk about, what's in the diet and things like that. But at the surface, without really knowing anything else, I can't really say for sure if that's too much.
We want to make sure that everyone has a chance to ask questions. So please speak up, raise your hand if you want to use that feature, or type it into the chat box. I think we're seeing those questions as they come in. Some people are a bit embarrassed to ask questions. please don't be shy if you have anything you'd like to ask. I mean, Divine is pretty amazing, but surely he didn't answer all the questions.
Somebody might actually be thinking about this, but one thing I didn't really include in this presentation is just a daily multivitamin. When I talk to patients about this, I have this talk with patients. They ask, well, what about a daily multivitamin? Is that a bad thing? Some studies have actually looked at that, and they've suggested that, as long as if you're taking a daily multivitamin and you're not exceeding the recommended daily allowances, a daily multivitamin is probably not going to cause too much harm. You just have to make sure that you're not, over supplementing. So really take a look at the back of the bottle and make sure that, whatever is in there is not, like 200% the daily limit and things like that. Anything 100 or under is usually okay. And so that's kind of what I recommend. But, taking specific supplements or vitamins like, vitamin A, those are, that's kind of where the risk.
Divine, I think Greg, who asked a question previously about the vitamin D, is hoping that you won't dodge his question. He says, I have had 3 colon cancers and aggressive prostate cancer and numerous skin cancers. That's back to the 2000 IUs of vitamin D daily. 3 colon cancers and aggressive prostate cancer and numerous skin cancers. Any thoughts about the 2000 of vitamin D a day?
Again, I'm a bit hesitant to kind of give a specific recommendation, but, with, having 3 colon cancers, aggressive prostate cancers, and numerous skin cancers, I'd probably suggest maybe holding that off and just discussing with your physician, just to kind of see if, they're just to kind of assess the situation a little better.
So Divine, another question from Angela Freeman about fruit and veggie capsules, juice plus, etc.
Yeah, so that's a good question, actually. So fruit and veggie capsules, a lot of these, I think I've seen this juice plus before. A lot of these tend to be basically super concentrated, antioxidant mixes. So I would say, the biggest risk with this is if someone's on active treatment. I would probably recommend holding that without really knowing anything else about what's going on. I would recommend, getting this from a balanced diet instead. The thing I didn't really mention about getting some of these supplements from a balanced diet is that, a balanced diet has other things that can sort of like counteract some of the toxicities and potential issues of specific vitamins. So taking, concentrated fruit mix capsules like this can be a problem.
So Divine, there's another question. I might make a stab at this myself, and you can give me your perspective. So there's a question that says, is the iron in a multivitamin really beneficial? I would say to that if you're not iron deficient, there's probably no value in the extra iron. Just as you said, if you're not deficient in the various vitamins, there's no real value for taking vitamin supplements. It's difficult, in my estimation, to become vitamin deficient in today's world, you really have to work at eating very, very poorly. But that would be my take on the iron in a multivitamin, is that if you're not iron deficient, you're probably not doing yourself any favors.
Yeah, I would agree. Unless there's really a reason to be supplementing, I would agree with that statement. Iron can also cause a lot of, you know, GI issues, and so that sometimes that can be a problem too. So,
You know, I think
Yeah.
if you're a young menstruating female, you know, some iron supplementation may not be a bad thing. But you know, for a postmenopausal woman or for a man in general, I mean, unless there's some evidence for iron deficiency, there's probably no real value.
I would agree.
Other questions? I just want to say, while we're waiting to see if any other questions come through, I think it's important to emphasize that Divine and I and the other people here at the Cancer Center and cancer centers in general, we have no particular attachment to chemotherapy or immunotherapy or any of the drugs that we use to treat cancer. The issue is really the presence or absence of evidence. You know, evidence to support response rates and improved survival, and in some cases, you know, cure rates for the treatments that we use. So, you know, this isn't us trying to, you know, keep Divine in business, or us, you know, getting some sort of benefit from giving the treatments that we give. I mean, I think if there's evidence to support a supplement or a mineral or a natural product, I'm all for it. And I think Divine would be too, again, if there's evidence for it. Here's a question, Divine, that says, is drinking V8 okay?
Yeah, I was actually just about to answer that. So, I would probably want to know a little bit more about how much V8 we're talking about. You know, so keep in mind again that the biggest risk with these is, you know, these V8 blends, the biggest risk with them is if someone is on, you know, active treatment and they're already getting a lot of these, you know, antioxidants and vitamins from a balanced diet. And certainly, you know, a bottle of V8 every now and then, that's really not an issue. That's not really where the risk is. It's when you're consistently drinking this on top of, you know, already getting some of these supplements and vitamins from a diet. That's kind of where the risk increases. And especially if you're getting, you know, radiation or certain types of chemotherapy, you know, you might get into trouble with, you know, countering the effects of some of that. So again, it really kind of depends. I'd like to know if there are any medications here. I mean, your average patient that is, you know, really not on anything, I wouldn't have a problem with, you know, V8. But then if we start adding other things on top of it, then that's when it kind of becomes an issue.
Divine, there's a question here that says, what are the risks of interactions for patients on tamoxifen that are drinking green tea?
So I would say drinking green tea, the tea itself, the amount of green tea that is obtained from the teas is usually not as significant as like a concentrated, you know, supplement or anything like that. Occasionally drinking green tea probably doesn't really have an effect on tamoxifen. It's those people that are drinking green tea consistently because they're trying to get some benefit and they are on tamoxifen and they're not aware of that interaction. That's when it becomes an issue. So again, occasionally drinking green tea, I don't think is going to significantly interact with tamoxifen, but overdoing it, so to speak, is kind of really when you know, we kind of have a problem.
So there's another question, Divine. I think the answer to this is probably we don't know. But if not on active treatment, is there any supplement to help boost the immune response to COVID or the flu? Obviously, there's an awful lot that's unknown about COVID. I don't think we have any good evidence, any quality evidence to support the idea that there's an immune booster that would help reduce the risk of COVID infection or reduce the severity of a COVID infection.
Yeah,
So
I would agree.
And even for influenza, which has been around for a long time, are you aware of any supplement? I think you addressed this early on about this idea, this advertisement or enticement that supplements somehow boost the immune system. I mean, I think there's very slim evidence for that. Is that correct?
Yeah, that's absolutely the case. We at least as of right now, we really don't know. So keep in mind that a lot of these claims are made based on, you know, maybe some observed effect on, you know, a cell that was studied in a lab, but we don't really show anything in clinical trials in actual people. So it's a very different thing to say that a supplement might have some immune boosting properties based on some observation in the lab and actually testing it in a complex, you know, human being and seeing those same effects. So you got to be kind of careful with that. And to date, we just don't have any evidence of that.
I think that's a very important point. You know, we talk about in medicine, we talk about in vitro versus in vivo. You know, it's very different having a few immune cells in a dish somewhere and sprinkling, you know, a supplement on them and you know, watching them react or expand, as opposed to, as Divine said, you know, an incredibly complex person. I don't think there's much in the way of quality clinical trials that support that sort of idea. Mostly it's some limited in vitro data, if you even want to call it that. I don't see any additional questions coming in, Divine.
Yeah, there's one last.
Oh, here we go.
Yeah, there's a couple more. There's one here about if you're not a big fruit and
I think we got the V8 question already, I think, was addressed. I mean, this is maybe someone else.
Right. Yeah.
Is drinking V8 okay?
Is drinking V8 okay? Yeah. I mean, drinking V8 in somebody that is malnourished, you know, there might be some benefit to that. You know, I'd really recommend in that case probably, you know, working with a dietitian. You know, but you know, again, if you're not having a good diet, drinking V8 probably doesn't have as much of a risk as somebody that's over supplementing.
Did you see a question about eye health supplements, lutein?
Yes, sorry, I just had to scroll down. Yes, so any input regarding eye health supplements with lutein and others? So the eye health supplements, unfortunately, I'm gonna kind of sound like a broken record. There is, you know, I mean, these supplements were formulated for a reason because there was some, you know, small data somewhere that said it might have an effect. Really, the issue is, you know, do we have any good rigorous, you know, data to support that? And with most of these supplements, the answer is usually no. To date, there really hasn't been any supplement that has been shown to have any kind of like preventative benefit, you know, at least in a rigorous clinical trial context.
All right, Divine, we maybe at a point where perhaps we should wrap it up. I appreciate your talk. It was excellent.
Thank you. Thanks, everyone.
We currently plan to do this again in April of 2021. Not this particular topic, of course, but somewhere within the next couple of months, we should have an announcement about the next topic. Again, I'm hoping that will be an in-person live session. If not, we'll make do with the virtual event. but it'll be something a bit different next time, and hopefully keep it exciting and interesting. So appreciate your time. Thank you, everyone. Thank you, Divine.
Thanks everyone for coming.